Well, welcome to the podcast, Planning with Purpose. And my name is Raymond Lavine. And today is a really good topic because I get to talk to a doctor who's not going to be looking at the keyboard or looking away. We're talking to a real doctor. And the topic is, medical decisions which families need to make for people who have cognitive, call it dementia or other cognitive issues and other long-term care conditions. And we have as our guest Dr. Brittany Lamb, who advises patients, let me emphasize, advises patients and clients to make confident decisions with dementia care and other long-term care issues. And we'll get into that because what happens is when you have a healthcare condition, it's a crisis. And for most of us, we really don't plan for it. I don't, most of us just don't know how to plan for it. And even if we do, once you're in a healthcare situation, your world is different. Brittany has her medical degree from Florida State University College of Medicine. She's also an emergency room physician, but advises families with medical crises, which is inherent when faced with a medical emergency. So, Brittany, let's start out. You're an emergency room physician. How did you go from emergency room physician, which you still do, and also where you advise family about dementia planning?
Yeah. So I think most of it has just kind of evolved naturally. I got super burnt out and crusty around the edges working in the emergency department. So, what we do there is we see people that are coming in for situations that they didn't expect, right? But I think the longer you work inside of the ER or in healthcare in general, we see patterns. And so when I see people coming in for things that I'm thinking to myself, well, if someone had just educated them about the fact that this could happen and had taught them about the different options for care ahead of time, they wouldn't be looking at me like I don't know what to do, either for themselves making decisions, or oftentimes as people are aging, it's the family members usually that are speaking on their behalf that are not prepared because they haven't thought about things. So dementia, unfortunately, the different diseases that cause dementia, we know that they'll get worse over time and that the person's expected to permanently lose the ability to make decisions, medical decisions. And so I thought, well, I could probably help people by just connecting them to this information that they need so they can think through these things when they have the space, the space and the energy and the time to kind of process things on their own. So it kind of is a journey from burnout to wanting to do something that I had control over and being able to make a difference on my own terms. So
in the emergency room in your area, do you have a preponderance or do you have a lot of people that come in that have some sort of cognitive or dementia? Is it more prevalent in where you practice emergency medicine?
yeah, so I live and work in Northern Virginia, and I definitely have an aging patient population. There's a lot of retirement communities around us, a lot of memory care communities. So the area that I work in used to be very rural, and it's a suburb of Washington, D.C. So they've built up this area over time, over the past 20, 30 years. So yeah, lots of people I see pretty much. I work in 3 different sites, and pretty much every shift that I work, I see at least one person who's living with dementia. So yeah, and I work night shifts too. So I used to work days. I worked days for about 5 years, and now I've been on nights for a couple of years since I finished my residency. Yeah, so I see a lot of people living with dementia, and some people are not diagnosed either.
When you say you work a night shift, I also think of, sundowners, if a lot of people,
Yeah, so we cause that. We cause that problem when we can't get people back home fast enough. Sometimes being out of your normal environment can contribute to that. But yeah, we see people, I commonly see people at night because they've fallen. And then a lot of times there are people who are still in the ER when I get to work, and we're transitioning their care from like the day doctor to the night doctor. And so yeah, lots of different stuff.
When somebody comes in with dementia, I hadn't really, put this in, things that I wanted to talk to you about. But Do they have to wait longer? Because I mean, unless they have a particular urgent health issue. In other words, what I'm asking is, do they have to sometimes wait because there's somebody else that has more urgent care, or if they have cognitive because they're maybe anxious or something, that you're more likely to treat them faster than, I mean, unless somebody is, bleeding or, I mean, in real critical condition.
Yeah, I mean, we have to triage patients, so it's a little bit different depending on how busy it is. I work in freestanding ER, so people get pretty much brought back into rooms very quickly. And then in the main hospital, it kind of depends. So if someone's brought in by family and they're stable and they're not bleeding all over the place and their vital signs are stable and they're calm and like they can hang out in the waiting room, then they would probably hang out. That would probably be a person who's more early or middle stages of disease, But the patients who come from living facilities almost always come by ambulance. And so typically we usually try to make room for ambulance patients, but we do sometimes have to put them in triage, and we have kind of a separate area. Every hospital is going to be a bit different in how they handle that. But if someone is obviously confused and not able to advocate for themselves, we would look at that person as kind of a liability being out in triage, so we would probably try to get them back, as soon as we possibly could. But it's a machine that never sleeps, and it's very unpredictable. So we just have to do the best we can with whatever's going on that day.
Well, what challenges do people face when they become responsible for a person with health issues, and they won't recover? Meaning they're going to gradually have more advanced cognitive issues. How do you advise families? And a lot of them, I'm sure they have probably said, "Oh yes, we looked it up on the internet." And either agree with us or we're going to tell you what to do. How do you advise families, whether they've done some research or this is something new for them?
Yeah, so I think the first place is really starting to look at, can this person still be involved in thinking ahead and planning for what might happen to them? Because if they can be, it's important to do paperwork, like naming who you want to speak for me from a medical standpoint on paper. Also, like there's legal and financial planning that's easier to do in the beginning stages. I think that what I think people really run into is not knowing what is okay and what is not okay as far as treatment goes, based on what is important to their person. So we know each other, we know our family members. I mean, I'm generally speaking here, but most of us know kind of what makes our family members tick, what's important to them, kind of what living well means to them, whether or not they care about quality of life. Like those things are the basis for how we make medical decisions. And I think people do sometimes struggle to like actually name them, to actually list those things out. But that's really how we decide what type of care is okay and not okay. So I think the first thing that people should do really is like think about whether or not this person can still be engaged in planning. And if not, it's, hey, we're in a situation where we have to realize that we're going to have to take over this work for someone. And just because they can't be involved with planning doesn't mean we shouldn't be, because we're going to be the ones left with making all these decisions, especially medical decisions. They can be very stressful. So, yeah.
Are you usually the first person if when they come in? I mean, you're an emergency. Do a lot of them already have a specialist, a neurological specialist, or do a lot of them come in and this is the first time that they've talked to somebody that has experience with cognitive or dementia care?
Yeah, so the ER is like the ER work that I do is, I'm a general emergency medicine doctor. So I see and deal with whatever comes into my freestanding ER or the hospital ER when I'm working. The work that I do outside of that is separate, and those people come to me in different ways. But in the ER, my patients are typically being managed by primary care doctors and sometimes neurologists as well. Those people are oftentimes, I'll know this because they'll be on medications that are familiar to me, like that we use to treat the symptoms of dementia. Um, but their specialists are not involved in the ER care, the hospital care. Primary care doctors too, they're not really coming to the hospital in general. They're not coming to the hospital anymore. So I don't really interact with them in diagnosing a person or managing dementia itself. Like typically what we're dealing with in the ER is some new medical problem, a fall, an injury, an infection, or like anybody else people living with dementia can have medical issues just like everybody else can, like appendicitis, their gallbladder, they can have heart attacks, strokes. So we're dealing with that new medical situation on top of the fact that they're living with dementia. But I do oftentimes, I have told families, now that I've done this work, I've been online kind of in this space, educating and advocating for people who are making medical decisions for someone living with dementia now for a few years. I do say in the ER, I'm very concerned that your mom, your sister, your husband, I think they might be living with dementia. And so sometimes I'm the first doctor that's actually point blank been like, look, you need to look into this and make sure that we're not missing another medical problem. So I talked to them about seeing primary care, neuropsychological testing, and then also, throwing out like neurology is a resource too. So, yeah.
It sounds like in some cases, people have not, don't have a primary care physician or a neurological. Sounds like, they come in and you're maybe the first person that's really said, look, they've got, these kind of cognitive issues. Am I correct on that, or am I?
Well, in most people that, like in general, people who are living with dementia and cognitive issues, a lot of them are Medicare age. There's people who are diagnosed earlier, and frontotemporal dementia is one of the diseases that is classic for presenting earlier in life that causes dementia. But a lot of my patients are patients who are receiving health care through Medicare. And so they do have primary care doctors, and a lot of them do have neurologists. But a lot of people don't have a formal diagnosis, even though they have primary care. So there are people who have been formally diagnosed and are on medications. And then there are people who I think something's going on here. And it's not just because they're ill or they're sick or they're injured. I really think that there's something else going on here, and they need to be worked up. And primary care is the first place to start. Most people who have Medicare have access to a primary care doctor.
You can only hope. I mean, I know people that they'll have a primary care in one state, but they'll transfer to another, and they're having difficulty finding doctors in their area. I mean, we have friends that moved from Washington State to Arizona, and they're having problems finding primary care, and they're both on Medicare.
Yeah, I mean, it's like there's definitely access issues for sure. And that's part of planning with a move. If you know you need healthcare, you got to think about that stuff. And sometimes people just don't think about it. But yeah, there is an access issue to access to good primary care doctors, internal medicine specialists, are good. Those are good ones to go to. And then geriatricians, even less of an availability for them. So yeah, there could be access issues. You're right.
Well, how should families plan if they need care services at home or in a care center? How will planning help those who need care and those who will be responsible for their caregiving? I mean, again, is this something that do you have some stories where families are saying, "Look, this has been going on for a while, and we really don't know what to do."
Yeah, yeah. I think what's hard for families is that what I have found is that a lot of people don't realize the importance and how helpful it can be to kind of plan ahead, because it's not what we're naturally inclined to do. Like most of the time with our healthcare, we have the same goal and intention, and that is to prolong life, to stay alive, and to live a good quality of life. And it's not really until our quality of life is maybe impacted by a condition or an illness, like such as a disease causing dementia, that we start to go, wait a minute, like is all of this care really what this person would want? And I think that like just being open about having those conversations can make a really big, make a really big difference. I've had lots of patients who haven't planned. And so like I had a daughter who was with her father, who's living with Parkinson's dementia, who came in like very sick from a urinary tract infection, was septic. You hear people talk about sepsis. His whole body was reacting to this infection. His organs were irritated because of it. His blood pressure was low. And, she knew that he was living with poor quality of life, that he would say he's living with poor quality of life, that he wouldn't want care that's geared just towards keeping him alive for the sake of it. But she didn't have a plan with her brother, who was also his medical power of attorney. And so she's telling me, well, we have to start this critical care, this life prolonging care until I can talk to my brother. So there's tons of situations like this where we're going against our natural instincts for what we know someone would want or not want because we haven't planned. And because there's an emotional side of it, right? Like you feel you want to do what's best for the person, but you also have to think about the relationships in your family that will be left over, after these situations happen. So, and then I've had people who have not done as detailed planning work, but have thought about like very specifically what quality of life means to my person, and everybody's kind of on the same page. Like I had this family that came into the ER. They came in because her blood pressure was high. She's living at home and her blood pressure was high. And then I realized that her blood pressure was high because she was hurting, and she was hurting because she couldn't pee, she couldn't urinate. So, and she also had a urinary tract infection is another situation, but not nearly as bad. But we talked about other options for how we could take care of her, other tests that we could do in the ER. And should we check out her heart because her blood pressure was so high? She can't tell us how she feels. So, and then they told me, well, no, doc, she would want to go home. She wouldn't want to be in the hospital because she can't enjoy reading books anymore. And she told us, like, when I can't recognize you all, when I can't have a conversation with you all, and I can't enjoy reading books, I do not want you to try to keep me alive for the sake of keeping me alive. So it's very interesting. The power of planning, really, I think it helps people feel less guilty when they're put in situations where they have to speak on behalf of someone that they love, and we can carry around a lot of guilt about decisions that we make or decisions that we don't make when it comes to medical care. And I could talk more about like planning for when you're staying at home or trying to age in place versus planning in a living facility.
Please do, because actually I'm curious whether it's the first time they've talked to you about it, or is it something where they're in the emergency room, but you have the experience, or do they ask you to say, look, we've got this situation. How should we set up our home for caregiving, or should we talk about transitioning to a care center?
Yeah. So, I mean, I think about what I do separate to what I do in the ER because I feel strange about I don't tell people about what I do, my business and my course and my program when I'm working in the ER.
We'll get into, how people can contact you and have a conversation. If they say, look, we like Dr. Brittany Lamb and we feel comfortable, we outside of the emergency, and we'll talk. I'll ask you about that, how they can contact you along with getting to your website. But anyway, go ahead about.
Yeah. So, but I feel like people find me and work with me as clients. They just kind of stumble upon me and find me through Facebook and social media, or someone tells them about me or whatever. And so, I think that a lot of us want to stay home and we don't want to live in care facilities. But I think some people also really enjoy the social aspect of it and the not having to manage a household. So, but I feel when we're planning for medical decisions, going into a living facility, people just have to realize that you're going to give up the ability of you calling an ambulance, of you calling for help. So it's very important to be on the same page with the people in the living facility who are providing care to your person about what their goals are, what quality of life means to them. If there's a certain point where they wouldn't want to go to the hospital, like, how are we going to logistically take care of them in that living facility if our goal is not to go to the hospital, right? Because they're going to call 911. Like, the most common things that I see are falls in the middle of the night where the person living with dementia cannot tell the staff how they fell. They can't say for sure that they're not hurting. And so they send them to me to be evaluated. That's one of the most common reasons I see people coming into the ER. So it's important to think about that and to kind of consider what we can do and not do within the rules of the living facility. But as much upfront conversation and planning with a team of people there is very helpful. When someone's staying at home, then it's okay, what is this person at risk for, and what could potentially make it so they need to go to the hospital, and what would that care potentially look like? And, when am I going to call for help, and when am I not going to call for help? When can I wait to talk to the doctor in the next day, or, take them to an urgent care, or do other things, So I think that from a medical decision planning standpoint, there are nuances there between staying home and then being in a living facility. But I think in like making the decision about whether or not you transition someone to a living facility is a personal, individualized choice. And it depends on the situation about like everybody. So I tell people that this is one time where when we make medical decisions for someone else, we want to speak as their voice. We want to like channel them when we're speaking for them. We want to do what they would do if they were capable of learning and understanding what's going on. But the choice about a living facility is something that has to consider the caregiver and the family. And if they're not doing well, like being this person's day-to-day manager of all the things, it is okay to transition a person into a living facility. And there's so many things that you could talk about with, I tell people, like, try to get a senior living expert to help you navigate this, because with a person living with dementia or anyone who's aging, the idea is that we try not to move people a ton of times. And we want to find a good match. Of course, there's the finances we have to consider. So there's so many individualized reasons why, but I tell people if there's safety issues or like the caregiver themselves is not healthy mentally or physically because of taking care of this person, we should be open to considering a living facility. We shouldn't stigmatize people for doing that. So,
well, usually it's also, it gets more involved in my experience as a long-term, extended care benefits advisor. I mean, I'll actually ask this question: do you sometimes where people come in where the person that needs to be treated has, a number of issues. But do you ever look at, the family members that some of them come in and say, I need to examine you. I mean, you look pretty, you look stressed, you look tired, you look frustrated, because we always think about, those that need caregiving, but we also usually never ask, well, how are you doing? As a kid.
Yeah, you're so right. It's we say in this space and this community, we're always saying you have to take care of yourself before you can take care of others, and it's true. But yeah, there are more help and resources out there than people I think are realizing, both free and paid services to help with caregiver burnout and the mental load that people take on when they're advocating for someone else. But yeah, it's so important. I see so many people who I wind up finding out that they're caregivers and they're my patient in the ER. And then I wind up kind of just in getting their history and trying to figure out what's been going on. I realize, well, they haven't been sleeping because they've been up all night, or they like have had this like chest pain or trouble breathing, but they've been ignoring it. Or I have all the time, people won't stay. They won't stay. I tell them, I really feel like you should stay in the hospital because there's more tests we can run. There's more doctors that can see you. I think we should watch you and, monitor this situation. And they're like, absolutely not. I've got to go home. I have my caregiver. So it's a tough place we're in, but I think there is more help and services and support coming for
let me
people.
ask you that. Interesting. What social services are available to assist families, along with, owning long-term care benefits?
Yeah.
But even if somebody says I've got Medicaid or I've got Medicare, that's just a plan that doesn't actually get you the people. You actually have to go out and get them along with, you were talking about care support, do you
Mhm.
recommend, people that are gerontologists or people that, what kind of people do you recommend to say, look, I'm an ER. I have also an expertise in cognitive care, but I don't necessarily have that expertise of, to come in and evaluate, your home situation and
Mhm.
say, look, do you have enough lighting? Do you have monitoring equipment? Do you have the furniture set up? Go ahead. I know.
Yeah, I think it takes a village. I think it takes like a very wide group of people to really help someone keep someone home, especially keep someone home as a caregiver. Um, but that, like what you're talking about, like home assessments and like trying to set yourself up for success at home, speech language pathologists and occupational therapists are extremely valuable. And then there's so many people now online who are so you can go through the traditional insurance route. Okay, so you can do that. You can also look at local area agency on aging to connect you with different services in your area. There's also tons of resources now online with people who have gotten frustrated with the healthcare system who are now creating their own content, materials, education. And so that is like if you, I mean, not to plug my own self, but like if you come and follow me on
Plug.
Instagram,
Please promote
if you
yourself.
come and you come and follow me on Instagram, it's at blam, so Brittany and then lamb.md. So at blam.md. Then you'll start to see the other people that I recommend, like nationally, who are providing education and support. The other person I would say is Natali Edmonds, Dementia Care Blazers. She is fantastic for supporting caregivers. In like she takes the lens of how do we take care of a person living with dementia. We take care of the caregiver, like we take care of those people because they're the number one asset. Like, and I agree with her. Like I'm in alignment with this with her. She's great. She was she did neuropsychological testing, so she's a geriatric psychologist,
Uh-huh.
and did neuropsychological testing on people to diagnose them with different diseases causing dementia and figure out what they were doing able to do cognitively. And then she got frustrated and came online and started this whole thing. So um, there's so many people out there, but I think PT, speech language pathology, getting some sort of certified dementia practitioner, like to learn from, either you're paying them or you're learning from them. And there's also people who are providing like caregiver coaching and more of the support, like for your mental health. I can't plug that enough. It's so important. I think every human being would probably benefit from talking to a therapist.
I,
So
I, no, I agree. There's a stigma about mental health, but I'm a great believer that we all need mental health. Um, you know, Whether I talk to my wife or my daughter or myself. Of course, if I'm talking to myself, I'm the worst mental health because I don't always get the best answers. But yeah, yeah, we all need people to talk to because we're all going through, some we all have pressures and issues and disappointments. That yeah, it shouldn't be a stigma, and we should have sources that we can go to. In fact, one of the things that I'll ask you to do is to create a list that we can put on the podcast, and also I will selfishly, if I have this that I can to people that I'm talking to that I can recommend, these services. Um, I don't know, if they, if they're just social service. Look, people want advice. They don't always like to pay for it, but people want advice. But if people don't, have the resource where they own long-term care benefits, or they have the resources, if you have, where there are social services that people can contact, I would like to know and put it on the podcast and to, uh, um, 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 you know, to have it for my own resources. But are there free resources that people can go to along with, those that say, look, it's like going to, your accountant or somebody to say, yes, I'm willing to pay for, help because I need help. I don't know how to do this. Go ahead.
Yeah, I mean, I understand everybody has limited resources and you have to spend your money however it fits your situation best, you know. But I do think that when we think about investing money when we're taking care of someone living with dementia, it's like what is going to save you time and stress, because those things are going to have health impacts for you. And saving you time is saving you money. So it's, you have to think about the big picture, I think. But you know, when it comes to free resources, I tell people like the best place to go is probably to your local area agency on aging, because they're going to know nonprofits, they're going to know volunteer organizations, they're going to know, you know, are there church programs? They're going to know what is available in their local area, and they need you to come there so that they can keep getting support and funding. And so most of those have some sort of you know, funding from like government funding typically.
Okay, so
So
it's local. It's not, state or federal. It's within.
there, it depends on the structure of where, like how populated the area is, and I don't actually know how they break them down, but sometimes they're county based, and then sometimes they could be like multiple counties or like a small region. But it shouldn't be at the state level. It's more local than that. And that's where I tell people to start looking for what is available. The other way you can kind of do this is to get into support groups that are local. And support groups are almost always free. So you find a support group, you find other people who are going through the same thing you are, and then you ask them for what resources they have. And they'll be able to tell you who's good, who's bad, who's too expensive, who's free, whatever, you know. So those are the places I would start, like boots on the ground. So, and then the other thing to think about is, this is a newer thing, but the GUIDE model, GUIDE, is like a federal initiative now. And I think there's like 350 programs that have been enrolled this year. And then they're going to roll out another section of programs next year in 2025. But that is a possibility for some people who are living with dementia, and they're trying to keep people out of living facilities.
Mhm.
So that would be something to investigate. And you can find that information on the cms.gov website if you type in guide model.
Okay.
Um, yeah, that would be there. It's not everywhere, and so it you know, not every place in the country is going to have access to it, but it's something else to consider.
Do you also, one last question, do you have, consult with companies? Because one of the areas that is becoming, in my field, of the companies should have benefits for their employees,
Mm.
not just for long-term care benefits, where it helps to pay for care, but also, where it has care, care support. People can call in and say, look, I've got this issue. What do I do? Are those, go ahead. What can and what should companies, and how would you advise them to have these kind of plans, or for you to actually, talk to companies about, because a lot of employees uh, are also caregivers, and that's the challenge is, you know how do you be a physician and be a caregiver? How do you be, work in a company and also, your spouse or partner, or somebody that you're responsible, that you're also a caregiver? How, you can't,
Mm-hmm.
it's hard to do both, almost
Mm-hmm.
impossible.
Yeah, I mean, it just depends on the situation and, you know, what resources you have. Probably a lot of it's going to be financially too. It's going to be how much care can you bring into your house, or can the person live in a living facility? And then how much time do you have to spread between your work, if you're raising family, and then advocating for this person. So, you know, I haven't done a lot of work or networking with companies. I've been mostly, you know, marketing my services right to caregivers, and that's kind of how I've been talking to them. But no, I think you make a great point. I mean, and what I'm obviously biased by what I do, but what I believe is a way to take stress and burden off of people is to be realistic about what we are at risk for as we're aging. And so if we think about the risks that we have as far as the medical conditions, and then we can start becoming educated about how those things are treated, we can create plans that are easy to follow for anybody who's speaking on our behalf. And when you're in the position where you have to speak for someone and make their medical decisions, laying down this plan, just like laying down an estate plan or a financial plan, it offsets this mental load that you carry around. People carry around stress every time the phone rings and there's a caregiver that you've paid for that is taking care of your person in the living facility calls you and you're like, oh my gosh, what am I going to have to drop and go and take care of now? And so I just think that this planning work helps with decreasing stress. And I think that in a way it could help people be able to balance the emotions and then be able to keep working. So companies probably would benefit from helping people have access to a guide to help them create this type of a plan.
Yeah, that they have not only plans but also care support, because
Mm-hmm.
that's I mean, look, it isn't just with older people. I mean, this is a crisis for childcare. If you have children, you have to make a decision. Uh, uh, can you find a place that will take care of your child, and are you willing to spend 10, 15, 20,000 a year? And then you have to decide, is it worth working, or do I stay home and take care of my child? Same thing, if you're older and you have a long-term care, it isn't just that you have the problem. It's do you have enough support? Are there enough people that can help you when you need caregiving, because you have a cognitive, you're frail or accident, or you're a child. They're healthy most of the time, but also that if you're working, you need somebody to look after them and make sure that
Mm-hmm. Yeah, I think companies would do a great service to their employees,
they.
providing more support. How they do that, I don't know.
No, we're,
But
we're working on that. Well, this has just been informative, and I hope we can schedule you in the future to come back, and I'll have more questions, and you'll have more stories, more information. So, Brittany, how can people get in contact with you? Your website, if you want to give your phone number. And if you want to just spend a minute or two about your website and what you offer, or if you also have, if people can contact you directly to have a conversation, whether it's a paid consulting or however you want to do it. Tell us how people can contact Dr. Brittany Lamb, so that when they're in a care situation, they say, I've got somebody to talk to. I've got somebody that's going to give me advice. Okay, I'll stop there because
yeah, well, so I will say that I'm just me. I'm just a one woman show. So I packaged all of my knowledge into a program. And so I sell that program to people. And then it's called Make Your Plan with Dr. Lamb. It's for people who are making medical decisions on behalf of someone living with dementia. So you go through at your own pace, but you never lose access to it. And then as part of that service, I do offer like email support. So if you have questions about your person's medical situation or what I teach, then you can email with me. And then I also look at the person's gathered and organized medical history and the
do you
situation
ask
of
them,
their
or I know I'm gonna. Do you
yeah.
ask them, or to say, look, in order for me to help you, this is the information I need in order to evaluate. And it's
Yeah.
all
So
by email,
yeah.
or is it sometimes where they can say, look, there's just more. I need to talk to you.
Yeah, so once people become a client inside of my program, I would then be able to talk to them and like consult with them. But if they haven't gone through my program, it's like we're not gonna be able to accomplish much on an hour call because I'm gonna be trying to teach you so much and figure out what's going on with you. So yeah, the clients that I work with send me their person's medical situation and their situation as the decision maker, so I can really analyze it and help them figure out like this is what you need to spend your time doing right now when it comes to planning. So that's a paid thing that I do, but I also do a lot for free. So the best way to really reach me and like get into my world and connect with me and see if we jive or whatever is to go to blammd.com/email and just put your name and your email address in and sign up to receive my emails, because I do like live question and answer sessions a couple of times a month. Yeah, I do that so people can literally on Zoom, I let them unmute now and like just talk to me. And I'm still a little bit
group conversation, or it's one-on-one?
Yeah, no, it's a group conversation. Yeah. I mean, if anybody, like honestly, if somebody wanted to get me one-on-one, first they have to become a client inside of my program. And then you're going to have to pay, because I schedule my day around these things. I used to do calls and people like wouldn't show up and stuff. So, and I still work full time, night shifts in the ER. So like, this is just like a side project that I have going.
Yeah.
But yeah, the best way to really connect with me and be able to ask me questions and then get access to like my blog articles and my videos and the free things that I give away to people. Like I have a checklist for decision makers and I have an audio training that's free. Like just come and connect with me via email. So it's blammd.com/email. That's Perfect. The simplest way. Yeah.
Well, thank you. This has really been informative, and I appreciate you being on this podcast. I really appreciate it. So here's where you can contact Raymond Lavine at 253-275-6091, or you can go to my website, www.lavineltcins.com, or also subscribe to the Prepared Caregiver. How can people connect with you? You have Facebook or LinkedIn? I know you have LinkedIn. That's it.
Yeah, Brittany Lamb MD on LinkedIn, on Facebook, and then Instagram is @blam.md.
Perfect. Okay, well, thank you. Anyway, everyone, experience a beautiful day in your neighborhood.